Hey guys, my name is Dr. Chad McKernan and I am with All Lasers. What I'm going to do today is briefly explain to you one of our premium machines, which is our Class 4 laser. This is FDA cleared and it's a 60 watt laser that is specially used for patients that have chronic and acute pain. So what I'm going to do right now is take you through the easy to use user interface, which has our custom protocols that are already planned for you, and you can actually do your own custom protocols too. So I'm going to take you through that right now. So when you look at our main menu, you have your preset protocols, your custom protocols, and your device settings. Now, if you're just starting to use this machine, the easiest way to do that is just go to our preset protocols and you choose what area of the body that you're going to use this on your patient. So of course you have your hand and upper extremities, your back and shoulders, head and neck, general conditions such as arthritis, your foot and ankle, and hip and knee. So what we're going to do today is just take you through our back patients, which most of your patients or a lot of your patients will be issued with. You have your lumbar spondylosis, just your lower back in general. What today we're going to use is our stenosis with patients that come in with lumbar stenosis. So you choose that, and there's two different settings that you can go with, which is our conservative setting and our aggressive setting. So if it's a first appointment, what we'll usually do is go with our conservative, and then of course as that patient progresses to your third visits, your 4, 5, and 6th visit, you can go up to aggressive. But we're going to choose conservative, and we're going to hit OK. And then as you can see here, all of that is preset for you. You got your 20 watts, you have your pulsed laser emissions, your frequencies at 50, and then you can go on and on with 10 milliseconds on, 10 milliseconds off. So what we're going to do is we're going to hit standby, which is going to turn on the laser, and you're ready to treat that patient. So at this point, you're ready to start treating your patient. So what we like to do is take the laser emitter, and we tell our techs or the other doctors to kind of put it around your neck just so you can have a good grip on it. So in case you drop it or it slips out of your hand, it doesn't bang against the table or fall against the ground. This is very delicate, so you want to make sure you take good care of it and that you're careful with it. A little button on the back of it. So again, what you're going to do is you're going to click that button, and that's going to turn the laser on. So again, if you're working on the bicep tendon, you want to make sure that that laser is on, and what you're going to do is you're just going to ride up and down the area of the body that you're working on, making sure that you're not going too fast or too slow, because if you do go too slow and you have that laser on a high setting, you could possibly burn the skin on that patient. And again, with this extender that you see on here, this is interchangeable. So I do recommend that you do use that, especially for the first few times that you use it on a patient, until you get the hang of moving back and forth, making sure that you leave a little bit of time and space in between each area of the skin that you are treating. And when you finish, you just hit that button one more time. That will turn the laser off, and you're finished. Okay, so we're ready to treat this patient. This patient came in specifically with neuropathy. So what we're going to do is set up the machine and the preset protocol for neuropathy and begin treatment. So again, the preset timer is always set for 10 minutes. And so unless you want to change that, you can, but all of the preset protocols are for 10 minutes. So what we're going to do is go into foot and ankle. We're going to go to neuropathy. We're going to go conservative once more, and we're going to hit OK. That will take us into our preset settings, and we're going to hit standby. And again, this laser is ready to treat. You push the button, and that's going to turn the laser on. And what you're going to want to do is go back and forth on the affected area, just above the skin, back and forth, making sure not to stay in one spot too long and burning that patient. And what I like to do, and again, tell our techs to do, is to actually travel right behind the laser just to make sure that the skin is not getting too hot. And again, as we can see, and as I can feel, that skin is warm, but it's not to the point where it's going to burn that patient. As you finish up with your patient, what you're going to do is you're going to come over to the control board, the user interface here. You're going to see that this is still red, which means the laser is on. You're going to push that. That's going to turn the laser off. You're going to place the laser emitter back on the table, and you're all finished. If you have any questions, concerns, or if you want more information, go to our website, alllasers.com, or you can reach one of our specialists on their email at alllasers@gmail.com. Thanks for watching.